You know that two systems of our body are the control systems, nervous system and the endocrine system, right? Endocrine system works through hormones. And you know that nervous system works through what? Electrical signal transmission, right? Very fast. But endocrine system works through hormones. That's why it is slow, because hormones must be produced, right? And released, then go to the site of action, then perform the task. First, we'll talk about the properties of the endocrine system. Then we'll talk about the important endocrine glands in our body. We'll see the location of those important endocrine glands in our body. Then we'll talk about the master gland, which is called the pituitary gland. It is the pituitary gland. We'll talk about that. And pituitary gland, although pituitary gland controls other glands of the body, but pituitary gland is controlled by the hypothalamus of your brain. So pituitary is the master, but hypothalamus is the master of the master, right? Hypothalamus controls the pituitary, then pituitary controls other endocrine glands of the body. So we'll see how hypothalamus is connected to the pituitary gland. Then we'll talk about the pituitary hormones. Pituitary gland has two parts, anterior pituitary and posterior part of the pituitary. Anterior part of the pituitary releases 6 hormones. Posterior part of pituitary releases 2 hormones. We'll know the name of those anterior and posterior pituitary hormones. Then we'll talk about the regulation of secretion of hormones, how the hormone secretion is controlled. Then we'll talk about the other endocrine glands and their hormones. First, the properties of the endocrine system. Endocrine system consists of endocrine glands. If you see the glands of your body, types of glands present in your body. Endocrine glands and exocrine glands. Okay, so these are types of glands. Endocrine system consists of endocrine glands. The properties of endocrine glands is that inside the endocrine gland, if this is the gland, these are the cells inside the gland, and these are the capillaries inside the gland. Okay, these are the capillaries. What happens in case of endocrine gland? These cells secrete the hormones in interstitial space. That means in between the cells, the spaces in between the cells where the hormone is released from the cells, and then the hormone enters into the blood, into the capillary. That means enters into the blood. So let me repeat again. In endocrine glands, hormones are secreted from the cells and the cells in the interstitial spaces. First, the hormones are secreted in the interstitial spaces. From there, the hormones enter into the blood, capillary blood.
The name of the space between the
interstitial space. Interstitial spaces. That means in between the cells.
And what's the of that?
Capillaries. Yeah. So first into the interstitial space, then what? Into the capillary. Into the capillary. That means into the blood. Make sense? Okay. Then blood will do what? Blood will take it to the site of action where the hormone should work. Make sense? Okay. So that's how the endocrine gland secretion occurs. In case of exocrine, what happens? This is the exocrine gland. These are the cells. Okay. And the hormones are released into the ducts. Ducts are tubes, tube-like structures. Okay. So hormones are released into the ducts. That means tube-like structures. So from here, the hormones are released into the ducts. In case of exocrine, yeah. And then the duct or tube duct. Okay. So from the cells, the hormones are released into the ducts, and from the ducts, the hormone is taken out. Okay, and will be given to the area just outside of the gland. So now you tell me, which hormone, endocrine or exocrine, works locally just outside of the gland? Exocrine. Which one can work really far? Endocrine, because once it enters into the blood, blood will circulate everywhere, right? So it can take from the head to the toe. It's not a problem because blood circulates everywhere. Is it clear? So now, if I ask you to tell me few differences between the exocrine and endocrine. First, I'll say that in case of endocrine, is there any duct here?
No.
No duct. So, ductless glands. How about in case of exocrine? You have ducts. Number one, difference, right? Number two, in case of endocrine, the hormone is released into interstitial space first and then into the blood. Make sense? So, hormones are released into interstitial spaces and then what? Into the blood. In case of exocrine, hormones are released into the into the ducts. The site of action would be far from the gland, because once the hormone is into the blood, it can take it far away from the gland. So the site of action could be far from the gland. In this case, that just goes outside and ends there. So the hormones will be released here and will work here. So hormones work locally near the gland, just around the gland. Now you tell me, if I ask you, which one has localized action, which one could have generalized action? Endocrine could have generalized action, right? Because blood will go everywhere. So this is generalized and this is localized action. Okay? So you got few important differences between the endocrine and exocrine systems. Since we are talking about the endocrine system, we'll focus on the endocrine glands. What is that? Okay. Important endocrine glands of our body. If you start from the head, in the brain, you have pituitary and pineal. Those two glands you have already seen. Then in front of lower part of the neck, here, you have the thyroid gland. Now if you go further, um, uh, in the back of the thyroid gland, you have parathyroid glands attached to the back of the thyroid. If this is the thyroid gland, attached to the back of the thyroid gland, you have parathyroid glands. Thyroid gland is only one. Parathyroid glands are 4 to 8 in number. It varies. Uh, in the back of the thyroid gland, you have parathyroid glands attached. Make sense? Yeah. Okay. And thyroid gland is how many? One. And parathyroid glands are how many? 4 to 8 in number. If you go further down, it didn't list here. In the upper part of thorax, here, you have thymus. You can add that. Thymus is also considered as an endocrine gland in the upper part of the thorax, just below the neck. You have thymus. Then, if you go to the abdominal cavity, you have the pancreas. Now, pancreas is not a purely endocrine gland. It is a mixed type gland. Pancreas is a mixed type gland. That means what? It has both endocrine and exocrine parts. That's why it is called a what? Mixed type gland. Now, which part of pancreas is endocrine part? That is the pancreatic islet. Okay, so pancreatic islet is the endocrine part of pancreas. Then on the top of your kidneys, you have adrenal glands sitting on the kidneys. So you have how many adrenal glands? Two. They are also called suprarenal glands because supra means above, renal means kidney. And then in male body, you have male gonads, testes, and female body, you have female gonads, ovaries. Those are also considered as endocrine glands because testis produces male sex hormone testosterone, ovaries produce female sex hormones estrogen, progesterone. Here you see the location of those endocrine glands. So you can go over that. Now, as I have mentioned, that your pituitary gland is controlled by the hypothalamus. So hypothalamus is the boss of the pituitary gland. And hypothalamus is very closely connected to the pituitary gland. If you see the brain structure, you see that hypothalamus is just above the pituitary gland. This is the pituitary gland. And this is the hypothalamus. So hypothalamus is just above the pituitary gland and very closely connected to the pituitary gland. So this is the anterior pituitary, and this is the posterior lobe of pituitary. Okay? So pituitary has two lobes or parts, anterior pituitary and posterior pituitary. Now, hypothalamus sends signal to the anterior pituitary via the portal blood vessel. That means through the blood, hypothalamus sends signal to the anterior pituitary. Okay? And hypothalamus sends signal to the posterior pituitary by the nerve fibers. These are the nerve fibers, and the bundle of nerve fiber is called what? Fibers is called what? Remember that? Bundle of nerve fibers or axons is called what? Tract. So, hypothalamus talks to the posterior pituitary through the tract, and hypothalamus talks to the anterior pituitary through what? Blood.
Anterior is blood and posterior is tract.
Yeah. So two ways hypothalamus sends signal to the pituitary gland. Is it clear? Okay. So basically what happens now, you can tell that these neurons of hypothalamus here will release the chemical into the blood, and that chemical will be taken to the anterior pituitary and will be released here and stimulate the cells. The posterior pituitary will be stimulated by the nerve signal, because these are the nerve fibers, tract, bundle of nerve fibers. Now, when the hypothalamus sends signal to the anterior pituitary releases the hormones. How many hormones you have in anterior pituitary? Anybody remember? I just mentioned at the very beginning. 6. 6 hormones. When the hypothalamus sends signal to the posterior pituitary releases the hormones. How many? 2. Very good. Into the blood, and then blood will take the hormone to the site of action. So, this portal system is called hypothalamo-hypophyseal portal system. Why? Because another name of pituitary gland is what? Anybody? Hypophysis. Do you remember hypophyseal fossa? How many of you remember on sphenoid bone? Hypophyseal fossa, the butterfly. And pituitary gland sits into that, right? In it. And I told you hypophyseal fossa. Why? Because another name of pituitary is hypophysis. So now I can say hypothalamo, this is hypothalamus, right? Hypothalamo, hypophyseal portal system. Can I say that? Because it is connecting hypothalamus and hypophysis. Hypophysis is what? Pituitary. Okay. And this is hypothalamo-hypophyseal what? Tract. Make sense? Because connecting those two structures, hypothalamus and hypophysis. Okay. The hormones, the chemistry of hormones. Chemically, hormones are divided into two types. Amino acid based hormones, amines, peptides, those are examples, and steroid hormones, sex hormones, adrenocortical hormones, that means adrenal gland hormones, sex hormones, those are the examples of steroid type hormones. Steroid hormones come from cholesterol, that is fat, and the amino acid based hormones come from the protein, because amino acids are proteins, you know that, right? Amino acids are protein, and cholesterol is fat. Okay, now if you see the structure of anterior and posterior pituitary. Posterior pituitary consists of neuron-like cells filled with neuron-like cells. Posterior pituitary. That's why posterior pituitary is also called neurohypophysis. Neural, and hypophysis is the pituitary, you know that. Neurohypophysis. Anterior pituitary is filled with gland type cells, glandular cells. Not neuron like cells, these are gland type cells. And this part is called adenohypophysis. Remember, adeno starts with A, and this is anterior pituitary. So anterior pituitary, adenohypophysis. Posterior pituitary is also called neurohypophysis. Adeno means gland. Okay, neuro is neural tissue. Okay, here in this picture you see how the anterior and posterior pituitary are connected to the hypothalamus. The hormones, 6 hormones of anterior pituitary are growth hormone, thyroid stimulating hormone or TSH, adrenocorticotropic hormone or ACTH, follicle stimulating hormone FSH, luteinizing hormone LH, and prolactin PR. Now you need to remember those 6 names. Okay, if I ask you which 6 hormones are released from the anterior pituitary, these are 6 anterior pituitary hormones. Growth hormone. Just write it down, the main information about growth hormone. It helps in what? Growth. Is very simple, right? Growth hormone helps in the growth of the body, and it works on all tissues of the body. All tissues of the body. But in 2 types of tissues, its action is more. In which 2 types of tissue? The skeletal muscles and the bones. So on skeletal muscles and what? Bones. On those 2 types of tissues, the growth hormone action is more prominent. Action is more. And you know that our body grows mainly by the growth of the bones and the skeletal muscles, right? So more growth hormone secretion will grow the body more. Make sense? Less will do what? Shrink. Will not grow the body normal, right? But normal amount of growth hormone secretion is essential for the normal growth of the body. Make sense? And we all, those who we have normal body size, during our growth, we had normal amount of growth hormone secretion. Make sense? Now, if during the growth of the body, secretion is more than normal, then what will happen? Bones and skeletal muscles and other organs will grow faster, right? So the person will be giant. It's called gigantism or giantism. You have heard that term, right? So Increased amount of growth hormone secretion during the growth of the body, when your body is growing, will cause gigantism or giantism. Same thing. The person will be very big and heavy. If the amount of growth hormone secretion is less than normal, then the person will not grow normally, will stay small, short, and that is called what? Dwarfism. Dwarfism. You know, dwarf. And gigantism. Also, we say giantism. Increased growth hormone secretion will cause gigantism. Decreased growth hormone secretion will cause dwarfism. That's why normal amount of growth hormone secretion will cause normal growth of the body.
You said that's during growth only?
Yeah, during the growth only. Now, if the growth hormone secretion was normal during the growth of the body, the person will grow normally. Make sense? And if suddenly the pituitary starts to release more growth hormone secretion after the growth is completed, then what will happen? In that case, some structures will grow. For example, the fingers, the bones of the fingers will get thick and wide. You will see the fingers will get thick and wide. The facial bones will grow in side, not in length, will grow in thickness, will get thick. The face will look big and the mandible will be pushed forward. That is called protruded mandible, protrusion of the mandible. Okay? And that condition, when you see the person has protruded mandible, that is called acromegaly. Okay? So, if the growth hormone secretion occurs more after the growth is completed, then the finger bones will grow in thickness, facial bones will grow in thickness, and you will see also the tongue gets thick and the mandible will be pushed forward. That is called what? Acromegaly, that condition. That will happen.
So if somebody took the growth hormone and steroids, all those would happen?
Those things you will see, the symptoms.
Are they reversible once their growth hormone goes down? Does the body?
Once it happens, acromegaly patient, we don't see it is reversible. It will stay like that. Okay. Now, the thyroid, before I go to thyroid stimulating hormone, the gigantism or giantism patients, you see, we can say patient or those people, if you don't want to say patient, they, almost all of them suffer from diabetes mellitus and other complications. Although their body is big, but glucose, growth hormone, increases the glucose in the blood. So always the blood level of glucose will stay high, and that will stimulate the pancreas, and pancreas will overfunction, bring the glucose down. Make sense? If your glucose is always high, then pancreas will do what? Release more insulin. Does it make sense? To bring the glucose down. So pancreas is always working more, and eventually it will burn out, and that causes the diabetes mellitus. So almost all gigantism or giantism people suffer from what? Diabetes mellitus. Make sense? Because their pancreas need to work more. And the lifespan is shorter than the normal average lifespan. Because testing that is one reason. Another is, I told you, growth hormone works on all tissues, right? So the heart will be bigger, liver will be bigger, soft tissue organs will be bigger too, larger, right? And is big heart good? No. Normal is what? Good, right? Normal size is good. Small is not good, big is not good. So malfunction of those organs will be also same. Make sense? So that's the growth hormone. Thyroid stimulating hormone works on which gland? Its name is telling you, right? Thyroid. It will stimulate the thyroid gland. Adrenocorticotropic hormone will work on the adrenal gland. It works on the adrenal gland. Follicle stimulating hormone works on the follicles of the gonads, testes and ovaries, and help in the growth of the follicles. Luteinizing hormone helps in ovulation, rupture of the follicle and release of the egg from the ovary. So it also works on the gonad, and on female gonad it helps in the ovulation. Luteinizing hormone. Okay, so just write it down. Helps in ovulation. Prolactin helps in the production of milk. So the prolactin secretion increases after the labor, after the birth of the baby. Prolactin secretion increases. So it helps in the production of milk in female breast or mammary glands. Posterior pituitary. How many hormones you have? Two. Oxytocin and antidiuretic hormone. Those are two posterior pituitary hormones. Oxytocin, first I will mention the important functions. Oxytocin causes the contraction of the uterus during labor or childbirth. So during childbirth, the contraction of uterus is caused by oxytocin. So it helps in childbirth. Number two, oxytocin helps in the ejection of milk from female breast. Ejection of what? Milk. Now you see here two things. If I ask you which hormone helps in the production of the milk? Prolactin. Which one helps in the ejection of milk? Oxytocin. Okay, because it causes the contraction of the alveolar clusters. Okay, so just write down those two important functions of oxytocin. Antidiuretic hormone. Antidiuretic hormone preserves water in the body. How? By decreasing the production of urine, decreasing the volume of urine. It takes the water back into the body from the kidney. Takes the water back into the body from where? Kidneys. So the volume of urine will be what? Less or more? If it takes back water into the body, the volume of urine will be what? Less. Make sense? The antidiuretic hormone decreases the volume of urine. Now you tell me, if the volume of urine is less, water is taken back into the body more, then the blood volume will be increased or decreased? Increased, right? Because water is getting back into the body.
It takes it just from the kidneys, right?
From the kidney. Right. So it will not get out from the body because it is taking back into the body. If it gets out, then the volume of blood will be what? Less.
I mean, once it gets filtrated through the kidneys and it's urine, it's getting ready to go out, it doesn't take it back in from there.
It does. It does.
It
Yes.
does.
Yeah.
Does it turn it back into water?
Right. So this is the nephron. Okay. So filtration occurs here. Okay. It's a good question. Very good question. So filtration occurs. That means from the blood, these are the capillary here. From the blood, urine enters here into the nephron. Okay. Microtubules inside the kidney, and then goes like this and antidiuretic hormone works in the last part of the nephron. If it gets out from here, that is urine. Okay? That is getting out from the body. Once it gets out here, it will not go back. But when the urine is passing through the nephron, it can be taken back into the body. And antidiuretic hormone works in the last part of the nephron and takes the water back into the body. But if antidiuretic hormone is blocked, then what will happen? Water will get out from the body. Okay? Yes.
Does ADH work in the colon?
Colon?
Yes.
I don't know. Have you heard anything?
Just curious.
No, it does. Oh, you are just curious. No, it doesn't. It doesn't. You are thinking if water is, we know that water absorption occurs in the colon, right?
Yes.
That's why you are asking. No, that's a different mechanism. Okay, not that. Okay, so antidiuretic hormone. Antidiuretic hormone has another action. It increases the blood pressure. Increases the blood pressure. Now, you see here, more antidiuretic hormone means what? More water will go back into the body, right? So blood volume will increase. So that will increase the blood pressure. Make sense? More blood means more blood pressure. But antidiuretic hormone also directly causes the constriction of the blood vessels throughout the body. Vasoconstriction. So if that happens, blood pressure also increases, because if you constrict the blood vessels, the blood pressure will go up. Okay? So let's write it down two ways. Antidiuretic hormone increases the blood pressure. One is by increasing the blood volume.
Increase the water volume, which presses it in?
No, that's a different mechanism. One is by increasing the blood volume, the blood pressure is increased. Another is it works on the wall of the blood vessel directly. What? Directly. Okay? And causes what? Generalized vasoconstriction. That means constriction of all blood vessels in your body. Vasoconstriction. Generalized means throughout the body, not localized. Opposite of localized. Okay? That is one way, and another is increasing the blood volume. These are two ways your antidiuretic hormone increases the blood pressure. Increases the blood pressure. Now, since antidiuretic hormone causes the constriction of blood vessels, it is also called vasopressin. The name, another name of antidiuretic hormone is vasopressin. We have mentioned here. Vasopressin, that means causes the constriction of the blood vessels. Okay. So we have talked about gigantism, dwarfism, acromegaly. You see the bottom picture here. This person. This is a very famous picture. Many textbook books use this picture. When I was a student, in our textbook, we had this picture. This guy, gigantism person, is from actually East St. Louis. If you go there, you will see his. There is a statue. So, now, regulation of secretion. The endocrine system is regulated by negative feedback mechanism. You know that two types of regulation are present in our body. When we talked in very first part of our class, you know that negative and positive feedback mechanisms. Negative feedback mechanism controls the secretion of endocrine hormones. That means what? You know that pituitary gland stimulates the other glands and other glands release the hormones, right? Because pituitary is the master gland. It stimulates the other glands and other glands release the hormone. Now, for example, pituitary is stimulating the thyroid gland. Here is the pituitary, here is the thyroid gland. Thyroid gland will release the thyroid hormone. Okay? And will keep releasing, and the blood level of thyroid hormone will go up. Make sense? And when it will reach to a certain concentration, the thyroid hormone in the blood, then what will happen? A negative signal will go to the pituitary as well as to the hypothalamus and will tell the hypothalamus to stop the pituitary and directly will tell the pituitary to stop sending signal to the gland. Make sense? So inhibition, that's why you see the broken lines showing the inhibition going to the pituitary and hypothalamus because in the blood concentration has already reached to the optimum level. Just know that the endocrine secretion is controlled by negative feedback mechanism.
So what about the positive?
Positive feedback occurs only in few cases. We have talked about that before. Blood clot formation, uterine contraction during labor gradually increases, right? So we have talked about those before. Okay, so you know 6 anterior pituitary, 2 posterior pituitary hormone. Now we'll talk about the thyroid gland. Thyroid gland consists of 2 lobes. So thyroid gland has 2 lateral lobes connected by an isthmus. This is the isthmus. It connects 2 lateral lobes. Okay? So 2 lateral lobes are connected by an isthmus. That's the shape of the thyroid gland. Now, you see inside the thyroid gland, you will find many follicles. Follicles are finger-like structures like this, heavily filled with follicles. Okay. So filled with many follicles like this. So if I now just see, if I make a slice cross section and take only this part from here, but I will see this is the thyroid gland, the lobe, and these are the follicles. So that I'm doing a cross section. So these are the follicles. Okay. Now, the wall of the follicles, you have the cells. These cells are called follicular cells. Makes sense? So these are follicular cells. Okay? And the follicular cells secrete the thyroid hormones, and in between the follicular cells, in between the follicles, here in those spaces in between the follicles, you have another type of cells. These cells are called parafollicular cells. So in the wall of the follicles, you have follicular cells, and between the follicles, the spaces contain the parafollicular cells. So those are 2 types of cells we see inside the thyroid gland. Now the follicular cells secrete the T3 and T4, those two hormones. Follicular cells secrete T3 and T4. T3 is called triiodothyronine and T4 is called tetraiodothyronine. So here, T3 is called triiodothyronine. Tri means three, right? So T3 hormone is also called triiodothyronine. And T4 is called what? Tetraiodothyronine. Tetra means what? Tetra means what?
Four.
Tri means three. Which one is tri? T3, right? And T4 is tetraiodothyronine, also called thyroxine. So T4 has two names, tetraiodothyronine or thyroxine. Those are released by follicular cells, these cells. Parafollicular cells release a hormone that is called calcitonin. So calcitonin is released from the parafollicular cells. Now, the functions of those hormones. T3 and T4 do what? T3 and T4, just write simple way. T3 and T4 increase the metabolic activities of the body, increase the metabolism of the body. Which ones? T3 and T4. Calcitonin lowers the calcium in the blood. So calcitonin lowers the calcium in the blood. Okay, here you see the cross section that I have shown here. And in the wall of the follicles, you have the follicular cells, and in between, you have the parafollicular cells. Another thing, just know that these follicles are filled with proteins, and that protein is called colloid. The follicles are filled with protein, and that protein is called colloid. Colloid. And the colloid or this protein has the amino acid that is called tyrosine. Tyrosine is the amino acid that makes the colloid or protein. Amino acid tyrosine. Tyrosin. Tyrosine. I believe. SINE. Tyrosine. Okay. Amino acid. Now you tell me, easy question. If I ask you in triiodothyronine, how many iodine atoms you have? Triiodothyronine. 3. In tetraiodothyronine, how many iodine you have? 4. It is telling, the name is telling you, right? Triiodothyronine and tetraiodothyronine. So how T3 and T4 are formed? T3 consists of 3 iodine atoms plus tyrosine. That amino acid tyrosine present in the protein is very important. Why? Because the tyrosine is used to produce T3 and T4. T4 is formed by produced by 4 iodine atoms plus tyrosine, amino acid tyrosine. That's how T3 and T4 are formed, produced, synthesized. Okay, so now you can tell that iodine is very important for what? For the synthesis of thyroid hormones T3 and T4. Make sense? If you don't have iodine, then T3 and T4 will not be produced because iodine atoms are essential, right, for the synthesis of T3 and T4. So lack of iodine can cause hypothyroidism. Okay, so just know the information I gave you here. Now, the function of T3 and T4. I mentioned just only one function. What is that? Increases the metabolism. So if hyperthyroidism, that means hyperfunction of thyroid gland, right? Hyperthyroidism occurs, then what will happen in the body metabolism? Too active. Metabolism will increase, right? Because T3 and T4 will be released more. So the metabolic activity will increase. So now you tell me, if you're in your body metabolism increases, what are the changes you will see? Just, just think simple way. If you do exercise, when you are doing exercise, the metabolism goes up, right? What kind of changes you see in the body? Heart rate is it, right? The body temperature is it, right? So those are the signs of hyperthyroidism. When you are even in resting condition, you will see those changes, right? Increased heart rate, increased body temperature. Makes sense? If somebody touches your body, you will see, feel the body temperature is high. Makes sense? Now, if that continues, hyperthyroidism, then what will happen? You mentioned skinny, because you know that if you do, your body metabolism is high all the time, then fats will be used up, right? The person will be skinny. Sleep disorder, less sleep, because body is hyperactive, right? Sleep disorder or insomnia, irritability, the person will easily get irritated. So those are the signs of hyperthyroidism. Hypothyroidism will do opposite. Lowers the heart rate because metabolism is less, right? So heart rate will be less. The skin, if you touch the body, cold. Okay, so those are signs of hypothyroidism. Now, prolonged hypothyroidism can cause a clinical condition, a couple of clinical conditions. One is called edema, another is called goiter. Hypothyroidism can cause those clinical conditions, myxedema and goiter. Myxedema is the accumulation of fluid in the face. So the person's face, you will see, is how the face will look like. Soft, right? Because fluid accumulates in the face, and puffy face. Okay, have you seen puffy face? Yes, like soft and fluid is there. Okay, so goiter is the enlargement of the thyroid gland. Enlargement of the thyroid gland is called goiter. Now, if you go to the third world countries, okay? Okay, you can go outside if you want, or you can stay here. Okay. So, if you go to third world countries where the kids don't get enough iodine, you'll see many kids suffer from goiter. What is that? Enlargement of the thyroid gland. Now, why that happens? Due to lack of iodine, why the thyroid gland gets bigger? Very simple, you already know. You remember I said that to produce T3 and T4, you need iodine bind with tyrosine, right? This is the protein, right? Amino acid. So, if iodine cannot bind with the proteins here, then what will happen? The protein will start to accumulate inside the follicles because protein tyrosine is not being used. Make sense? So more and more protein will accumulate here because they are not being used to produce T3 and T4. There is no iodine. The tyrosine will not be used. And the follicles will get what? Bigger. All follicles will get bigger. So the whole thyroid gland will get bigger. And that's the enlargement, cause of enlargement of thyroid gland because proteins are not being used. Tyrosine. Now, if you give iodine to those kids, what will happen? You'll see the thyroid will shrink quickly because iodine will quickly bind with tyrosine and tyrosine will go down. Is it
So-
clear?
So, will they die from that?
No,
So
no, no.
Metabolism's not working?
No, because some amount of metabolism will occur, so they will not die. It's not that life-threatening condition. Okay, so we have talked about the thyroid hormones. Now, parathyroid glands. Parathyroid glands are attached to the back of the thyroid gland. And how many parathyroid we have? 4 to 8. So they are small glands attached to the back of the thyroid gland. Parathyroid glands produce a hormone called parathyroid hormone or parathormone or PTH, very important hormone. Parathyroid hormone increases the calcium in the blood. So parathyroid hormone does what? Increases the calcium in the blood. Which hormone lowers the calcium in the blood? Calcitonin. Do you remember that? Calcitonin is thyroid hormone or parathyroid hormone? Thyroid. And parathyroid produces only one hormone. That is called what? Parathyroid hormone. Make sense? Very simple. Calcitonin lowers the calcium in the blood. Parathyroid hormone does what? Increases. So by the action of those two, our blood level of calcium is maintained. Make sense? Okay. So if your blood level of calcium goes down, which one should be released? Parathyroid hormone to increase it. Make sense? If the blood calcium level goes up, then which one should be released? Calcitonin to lower it. Make sense? So now, how parathyroid hormone increases the blood level of calcium? We know that parathyroid hormone increases the blood level of calcium, but how it does it? It works on three structures, three ways. It works on number one, bones, number two, kidneys, number three, intestine. Okay, so parathyroid hormone stimulates osteoclasts. Osteoclasts are what type of bone cells? Anybody?
Destroy the,
Destroy, yeah, very good. So, you know, they are giant, right? Big. They love to destroy the matrix, right? I told you before. So, osteoclasts will destroy the matrix. And bone matrix is heavily filled with
calcium.
calcium, you know that. So, calcium will be released Very good. Release of calcium. Calcium will enter into the blood. Because once the bone is destroyed, the matrix of the bone is destroyed, calcium will get out from the bone. Make sense? And will enter into the blood. So blood level of calcium will go up. Make sense? So this is how the parathyroid hormone will work on the bones to increase the calcium. Kidney, very simple. You tell me. Parathyroid hormone increases the blood level of calcium, right? So it should let the calcium get out or should preserve it. Preserve it. So parathyroid hormone works on kidney nephron tubules and takes the calcium back into the body. Make sense? So the blood level of calcium will stay high. Is it clear? So takes the calcium back into the body from the kidney. The same way I talked about antidiuretic hormone takes it back. That means retention. Retention of calcium. Now on the intestine, parathyroid hormone doesn't work on intestine directly. It does what? Increases synthesis of vitamin D. And vitamin D works on the intestine and increases absorption of calcium from the food we eat. You know that food goes to the intestine, nutrients, and are absorbed there. So, parathyroid hormone increases the production of vitamin D, and then vitamin D increases the absorption of calcium from the food we eat. So, more calcium absorption in the intestine means more calcium will enter into the blood, will increase the blood level of calcium. So, just write down these three things and how the parathyroid hormone increases the blood level of calcium.
The vitamin D that's done by the kidneys, right?
Okay?
Vitamin D does the kidney job, which stimulates the intestine.
Yeah, we have talked about that before, right? In the skin, polycalciferol that goes to kidney becomes calciferol, and
that's what activates the intestines to absorb more
yes,
calcium.
parathyroid hormone activates it, the synthesis. Okay, so that's about parathyroid gland. Now we'll talk about the adrenal glands sitting on what? Kidneys. How many adrenal glands we have? Adrenal glands are also called what? Suprarenal glands sitting on the kidneys, like cap or head on the kidneys. So this is the kidney. This is the adrenal gland sitting on the kidney. And if you cut the adrenal gland and see inside, clearly you'll see two areas. Outer part is called the adrenal cortex and inner part is called the adrenal medulla. Okay. Now, if you see the cortex under the microscope, you will see three distinct layers in the cortex. How many layers in the cortex? Three. 1, 2, 3. Okay, 1, 2, 3. Three layers in the cortex, and those three layers work as three different types of endocrine glands. Work as what? Three different types of endocrine glands. Three layers of the cortex, and release three different types of hormones. Adrenal medulla works as another endocrine gland. So how many endocrine glands are inside this endocrine gland? How many? Four. Three are in where? Cortex, and one is the medulla. Okay? So you see, three layers of cortex work as three different endocrine glands, and medulla works as another endocrine gland, right? So how many endocrine glands in one? Four. Okay. So we'll see the name of these three layers and what type of hormones are produced from these three layers of the cortex first. Those three layers are zona glomerulosa, zona fasciculata, and zona reticularis. Okay, I will ask you the questions. If you can't answer, then we'll be in trouble. Okay, so how many layers in the cortex?
Three.
And what are those three layers? These are the name of those three layers. Okay, you need to remember these names. And what type of hormones are released from these three layers? Zona glomerulosa releases mineralocorticoids. Zona fasciculata releases glucocorticoids. And zona reticularis releases sex hormones. So you see, sex hormones are also produced by the adrenal gland. Just know that mineralocorticoids regulate the minerals. That's why they are called mineralocorticoids. Okay? Regulate what? Minerals. Sodium, potassium, calcium, magnesium, all those are minerals. The most important mineralocorticoid is aldosterone. The main mineralocorticoid. The name of main mineralocorticoid is aldosterone. But just know that it works on kidneys to regulate the minerals in the blood. Glucocorticoids. Glucocorticoids are, you already know the names, cortisol, hydrocortisone. So glucocorticoids are cortisol, hydrocortisone. Those are glucocorticoids. Have you heard hydrocortisone? Where did you hear? Yeah. You will see the ointments. If you get inflammation, you or red eye, you get the ointment or drop hydrocortisone. Have you seen that? 1% or 2%, right? Or 0.5%. Very small concentration, but it has what? Strong anti-inflammatory action. Very strong anti-inflammatory action. So basically, cortisone, hydrocortisone, or cortisol, hydrocortisol, those are glucocorticoids. Glucocorticoids also regulate the metabolism of glucose. That's why they are called glucocorticoids. Metabolism of what? Glucose. So those are the important functions of glucocorticoids.
Cortisone.
We use both cortisol or cortisone. Cortisone usually we use in commercial when it's in brand name. Actual name is cortisol, okay? In brand name we use cortisol. And sex hormones are released from the reticulars. Now if I ask you in general, you tell me what are the important functions of the adrenal glands? I will say that. Can you mention number one? Regulation of minerals. Very good. Number two? Metabolism of glucose. Number three? Strong anti-inflammatory action. Is it clear? And also production of sex hormones, right? And sex hormones have a number of actions. So those are important functions of your adrenal gland. Now, the medulla. So you already know three layers of cortex and their hormones. The medulla releases two hormones, adrenaline and noradrenaline. Okay? Uh, Adrenaline and noradrenaline. Okay? And just know that adrenaline and noradrenaline, they activate the sympathetic division of autonomic nervous system, activate the sympathetic nerves. And you know that sympathetic activation does what kind of changes I mentioned before. And it will increase the heart rate, increase the metabolism, increase the muscle tone, right? Like hyper activity of the body, sympathetic. So you know that adrenaline. Sometimes you, when you get the movie DVD, you will see on the box. This movie has a lot of action, suspense. Will increase the adrenaline in your body or blood. You see that adrenaline. That means you will get hyperactive, excitement. Abnormal secretion of glucocorticoids can cause the clinical conditions. Just know a couple of those. Hypersecretion of glucocorticoids causes Cushing's syndrome. Cushing syndrome, what are the signs of Cushing syndrome? When you will hear you see the difference between a syndrome and a disease. What's the difference between a syndrome and a disease? Syndrome has multiple different types of complications. That's why we say syndrome. It has different types of problems. So in Cushing syndrome, what you will see the signs, just write down the signs. Number one, moon face. Face is round, like a full moon. Moon face. Another is buffalo hump. In the back, a lot of fat accumulates in the back of the shoulder and neck. A lot of fats accumulate in the back of the neck and shoulder. Okay? And another is acne, spots, dark spots throughout the body. Those are uh, the symptoms of Cushing syndrome.
Isn't it also caused by prednisone?
Yes, exactly. Because the same thing, penicillin is a glucocorticoid. Cortisol, hydrocortisol, prednisolone, those are glucocorticoids. So if you take glucocorticoids, you will see those changes. Hyposecretion of glucocorticoids causes Addison's disease. Just know that the main problems of Addison's disease, one is strong hypotension. That means blood pressure drops a lot. Hypotension or decreased blood pressure. Abdominal pain. So those are some complications of Addison's disease.
So how many does it have to be, how many symptoms are needed to classify it as a syndrome or disease?
There's no limited number. We say phantom limb syndrome, right? Phantom limb pain. If only pain is there, if someone loses the limb, And if you only feel pain, no other problem, then we say phantom limb pain. But if you see, most of the cases, what happens, the person who loses the limb, lot of things, pain, as well as, the person feels that whole hand is there attached, okay, and other many other things occur at the same time. That's why we say syndrome. So there is no limited number, these many numbers or that many numbers. Gonads. Male gonads are testes, female gonads are ovaries. Gonads produce sex hormones, and sex hormones perform some important functions. Number one, you can write it down: growth of growth and development of reproductive organs. Number two, production of sex cells. Spermatogenesis in case of male, oogenesis in case of female. That means production of sperm or ovum. Production of mature sperm or ovum. Number three, responsible for the secondary sex characteristics. Now, what are the secondary sex characteristics? By looking those characteristics, you can separate a male and female externally from outside. Okay, so male secondary sex characteristics are what? Facial hair, right? Distribution of hair. Number two, what is this? Laryngeal prominence. Adam's apple, right? In male. Voice is what? Deep, loud. What else? Skeletal, broader shoulder, skeletal muscles, right? Prominent skeletal muscles. So those are male baldness. Those are male secondary sex characteristics. Female sex hormones give female secondary sex characteristics. That means what? Voice is high pitch, right? You can hear from far. Sometimes, sometimes we close the door. High pitch, high frequency sound. Um, Another is distribution of fat under the skin, subcutaneous fat, nicely distributed. Um, Broader hip. Okay, so those are female secondary sex characteristics. Another function of sex hormones is sexual behavior and drive. Those are controlled by sex hormones, right? Sexual behavior and drive. So I have mentioned how many functions? 4. Number 1 is growth and development of reproductive organs, right? Number 2, the production and maturation of sex cells, right? Number 3, secondary sex characteristics. And number 4, sexual behavior and drive. Okay, so just remember those 4. Okay, good. So we